Good morning or good afternoon, depending on where you are in the country. My name is Anne Deschamps. I'm with the Mid-Atlantic ADA Center. Welcome to the Healthcare and the ADA Inclusion of Persons with Disabilities webinar. As I said, I'm Anne Deschamps. I'm your moderator today. I am joined by Pam Williamson from the Southeast ADA Center. This series is brought to you by the Pacific ADA Center, so it's a nice collaboration on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information as needed on the Americans with Disabilities Act. You can reach your regional ADA center by dialing 1-800-949-4232, and you will get connected to the center that serves the area code that you're calling from. Some of you may be aware there are some issues with AT&T, and just want to let people know if for any reason we cut out, we will get back up as soon as possible. Next slide, please. Okay, some instructions on captioning. Real-time captioning is provided for this webinar. The caption screen can be accessed by choosing the closed caption icon in the meeting control toolbar. Next slide. If you do not have sound capabilities on your computer or prefer to listen by phone, dial 1-669-900-9128 or 1-646-558-8656. The webinar ID is 870-343-09711, and the passcode is 280122. This is not a toll-free number. As always in these sessions, only the speakers will have audio. Next slide. This webinar series is intended to share issues and promising practices in healthcare accessibility for people with disabilities. The series topics cover physical accessibility, effective communication, and reasonable modification of policy issues under the ADA. These webinars occur every other month on the fourth Thursday of the month at 2:30 Eastern Time, 1:30 Central, 12:30 Mountain Time, and 11:30 Pacific. By being here, you are on the list to receive notices for future webinars in this series. The notices go out 4 weeks before the next webinar and open that webinar to registration. At the conclusion of today's presentation, there'll be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform. The speaker, Claire Stanley, Pam, and I will also address questions periodically throughout the session. So feel free to submit them as they come to your mind while we are presenting. Submitting questions. You may type and submit questions in the chat area text box or press Alt-H and enter text in the chat area. If you are listening by phone and not logged into the webinar, you may ask questions by emailing them to adatech@adapacific.org. Next slide. For technical assistance, if you experience any technical difficulties during the webinar, send a private chat message to the host by typing in the chat window. Type your comment in the text box and then enter. Keyboard is Alt-H to access the chat box via keyboard keys, or email adatech, ADATECH @adapacific.org, or call 510-831-6714. Next slide. Okay, let's get started here. Welcome to Who Let the Dogs and Miniature Horses In? Service Animals in Healthcare Facilities. According to the Bureau of Global Public Affairs within the U.S. Department of State, approximately 500,000 service dogs assist people with disabilities across the country. Under the Americans with Disabilities Act, service animals must be given access to places their human handlers go, including healthcare facilities. As service animals become more common, healthcare professionals are more likely to come in contact with them in doctors' offices, hospitals, and other medical settings. As a healthcare provider, this webinar will help you understand the ADA, service animals, and how to develop procedures that will enhance your ability to provide comprehensive, patient-centered care. I am clarifying that although Claire is an attorney, the information provided today by Claire or myself or Pam is not intended as legal advice. Okay, next slide. I am happy to introduce Claire Stanley. Claire is the Director of Advocacy and Governmental Affairs for the American Council of the Blind. Claire has been involved in the field of disability advocacy for over a decade. In a former role as a public policy analyst at the National Disability Rights Network, she advocated for policies that impacted people with disabilities and also collaborated with other disability organizations. Claire has had years of experience in accessing the healthcare with a service animal. Her current dog is a lab named Tulane, who, by the way, just a little fact, was featured on Disney's Channel's TV show Pick of the Litter about service animals. I'm going to be starting off the webinar here and then turning it over to Claire when we get to the part about reasonable modifications. Next slide, slide number 3, please.
And I need to stop you for a minute. Our interpreter, can you please move your camera a little bit? Some folks are having a hard time seeing your hands. So is that for those that asked for that? Can you let me know in the chat if that's better?
Okay, Pam, don't hesitate to interrupt again.
Okay, that's better. I can see your hands now. Thank you.
Okay, great. All right, let's talk about our learning objectives here. We're going to talk about the definition of service animals under the ADA. We're going to list the questions that can be asked about a service animal and talk about them a bit. We're going to identify places that service animal can and cannot visit with his or her handler. We're going to understand how to interact appropriately with the service animal and its handler. And we're going to recognize the importance of having a service animal policy. Next slide, please. As I said, this is being brought to you by the ADA National Network. As I said, the Pacific ADA Center is putting on the webinar. I am from the Mid-Atlantic ADA Center and Pam is from the Southeast ADA Center. We are 10 regional centers providing guidance, training, and materials on the Americans with Disabilities Act for the entire country. You can reach your center by dialing 1-800-949-4232, or you can go on the web to adata.org and get connected to your center. Next slide, please. The ADA National Network is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, otherwise known as NIDLR. NIDLR is a center within the Administration on Community Living, otherwise known as ACL, in the Department of Health and Human Services, HHS. These contents do not necessarily represent the policy of NIDLR, ACL, or HHS, and you should not assume endorsement by the federal government. The information and/or materials provided are intended solely as informational guidance and should not be construed as legal advice, just in case I didn't make that clear earlier. All right, slide 6. We're going to start with a brief overview of the ADA. Okay, next slide. What is the ADA? Well, the Americans with Disabilities Act is a civil rights law that was passed in 1990. And on the screen, we have a quote. The nation's proper goals regarding individuals with disabilities are to assure equality of opportunity, full participation, independent living, and economic self-sufficiency. The purpose of the Americans with Disabilities Act is to provide civil rights to people with disabilities. This law also teaches all of us how to create a more inclusive society. Next slide, please. The ADA applies to employment, which is also known as Title I, state and local governments, Title II, which we're going to be talking about today, Title III, public accommodations, which are private businesses, including nonprofit organizations, transportation, which is in Title II and Title III, and telecommunications in Title IV. Next slide. So, as I said, we're focusing on Title II and III today, and because their healthcare facilities are covered under both Title II and Title III. And some examples of healthcare facilities under Title II include state hospitals, county health departments, city mental health clinics. Slide 10, please. Some examples of healthcare facilities under ADA Title III. Any kind of private hospital or urgent care clinic, medical practice, mental health care provider, or dental practice. Next slide. Okay, Claire.
Yes. Hello.
Oh, I'm so glad you have a picture of Tulane up there on the screen so everybody can see you and Tulane there. So.
Oh, perfect. And
yes.
Can you see me as well, Anne?
I'm sorry?
Can you see me as well? Am I on camera?
No, you are not on camera right now.
I must have been taken off. Let me put myself back.
There you are. There you are.
Although looking at my dog probably was more exciting.
Well, no, now everybody has a good idea of what Tulane looks like. So let's dive right in with what is reasonable modification under Title II and III of the ADA.
Perfect. Thanks, Anne. So what is a reasonable modification? And I'm going to start real quick by saying you might be thinking, well, why are they using the word modification? Because oftentimes we hear the word accommodation, reasonable accommodation under the Americans with Disabilities Act. And for all intents and purposes in this situation, they're the same thing. It's just a fun trivia fact for the Americans with Disabilities Act. A reasonable accommodation applies in the workplace. That's Title I. But under Title II and Title III, they use the term reasonable modification. There's probably some legislative history to that. I don't know what it is, but it's just a fun bar trivia fact you can say. So we're going to use the term reasonable modification here. So it's used in Title II and III, like I said, in the Americans with Disabilities Act. And the definition is adjusting, policies, practices, or procedures, if that's needed to ensure people with disabilities can gain equitable access to goods, services, and programs. So the practices, policies, and procedures is kind of the magic term, and then the goods, services, and programs. Next slide. So we'll continue to talk about reasonable modifications, but specifically as it applies to service animals, what we're here to talk about today. So generally, a public entity or public accommodation shall modify policies, practices, or procedures to permit the use of a service animal by an individual with a disability. So again, Title II regulations or Title III regulations. I think we have those up there, if I remember correctly, if anybody wants to link directly to the Title II regulations. And
yeah,
then
I'm sorry to interrupt, Claire. I think the Pacific ADA Center is going to put the link to the regulations directly into the chat, because these links we realized when we were checking them that they're dead. So they take you to an old Department of Justice page. So right. that links do not work which is exactly what I'm saying right now. So the correct links are in the chat right now. If we just want to take a minute to let people note those direct links, you can also cut and paste and put it into Google, and you'll be taken to where you need to go. Okay, back to the regularly scheduled program, Claire.
Awesome. Great. So moving on to our next slide. So what are service animals? The big question of the day. So next slide. So we're going to define what a service animal is. And this definition is coming from the Department of Justice. That's who oversees Title II and Title III issues for the Americans with Disabilities Act. So according to the Department of Justice, it's any dog, hence the word dog. We'll also talk about miniature horses, but any dog that's individually trained to do work or perform tasks for the benefit of an individual with a disability, including a physical, sensory, psychiatric, intellectual, or other mental disability. So we'll go over these in a minute, but I just want to emphasize a few highlights here, I should say. They're trained to perform tasks, so they got to be able to do a task to benefit a person with a disability. So not just anybody, but a person with a disability. And as you can see, for all kinds of different disabilities. So it's not just what many of us think as a guide dog. For people who are blind like myself, can be a whole slew of different disabilities. Next slide. So monkeys and ferrets and snakes, oh my.
Hold on a second, Claire. I think we're one slide behind. So
are we?
Yeah, we want to move on to slide 15.
15.
There we
Thank
go.
you.
We're good. You're good now. You're in sync.
Perfect. Well, I can do it again. Monkeys and ferrets and snakes. Oh my. So again, this is talking about what qualifies as a service animal under the Americans with Disabilities Act. I'm sure many of us have heard all kinds of stories about different service animals that have been out there. But according to the Americans with Disabilities Act, as it was amended in 2008, species other than dogs, wild or domestic, trained or untrained, are not considered service animals under this part of the ADA, Title II and Title III. There's a few other exceptions under Title I, potentially, under many other pieces of federal legislation that we can answer questions to if we have time. But under Title II and Title III, only dogs are service animals, with the small caveat that we'll talk about in upcoming slides. So for instance, cats, birds, monkeys, those ferrets and snakes, oh my, those cannot be service animals under the Americans with Disabilities. However, there is a qualification, and so I think we'll go to our next slide. Miniature horses. So reasonable policies modifications must also be made to allow an individual with a disability to use a miniature horse that has been, again, similar language as we talked about before, individually trained to perform work or tasks for an individual with a disability. So again, this is the one small caveat. There's a few exceptions so that we'll talk about in upcoming slides, but so it's dogs or miniature horses. If you see anything else under Titles II and Titles III in healthcare facilities, only dogs and sometimes miniature horses. Next slide. Okay, so service animals are working and active. So what does that mean? These dogs or miniature horses must be trained to perform specific actions, tasks, or work for individuals with disabilities. So what does this mean? So Anne talked about my guide dog. I'm blind and I have a dog that was individually trained to perform tasks. So because I'm blind, I want to be safe. And so when I walk down the sidewalk, she's trained to guide me around obstacles, to stop at curbs and stairs, to target different locations like a bus stop. She's individually trained to perform a task. So she's actively doing something. That's the distinction between just a dog that's hanging out versus a dog that's doing something. Next slide. Examples of a service animal's work. I just gave you a few of my own individually as somebody who has a guide dog, But like I said, there are so many different types of service animals or service dogs. I should use that language appropriately since we're making that specification. Providing physical support and help with balance and stability for people with mobility disabilities. I've heard some really cool ones out there about people with balance issues who will have some pretty sizable dogs out there so that they can lean on them and remain stable. Guiding individuals who are blind or have low vision like myself. Pulling a person's wheelchair. I have a good friend who has a pretty severe muscular disability. And so when she gets weak and can't use her manual wheelchair on her own, her dog will pull her wheelchair. Retrieving items for a person with a disability. That same friend has her dog get items for her all the time, including opening up the refrigerator and getting a can of beer out of the refrigerator. Alerting individuals who are deaf or hard of hearing. So if a smoke alarm goes off, things like that, the dog can let them know. Preventing or interrupting behaviors for persons with psychiatric disabilities. So some pretty cool ones, if the person might be going into a panic attack or something like that, the dog will notice and nudge them, get them into a safe place, things like that. Alerting individuals for oncoming seizures. Those ones I think are amazing. They have the ability to nudge their person when a seizure might be coming on, again, getting them to a safe place that they're lying down and they won't hurt themselves. Next slide. Other types of assistance animals. So note that it says assistance. We have here in parentheses, not service animals. There's a lot of really cool animals out there that are assistance animals, emotional support, or comfort animals, and they so do some really awesome and important things, but they're not service dogs or service animals. What do? They do things like provide comfort, companionship, emotional support. But the difference is we talked about how a trained service animal performs a task or tasks. They pull someone's wheelchair, they alert to a seizure, they guide me down the sidewalk. Whereas a comfort animal, they're just helping you be comfortable. They're helping you when you're upset, but they're helping you just in virtue of being there. So that's the distinction. They're not performing a task. They're just being around you makes you feel better, provides emotional support. But remember, one is performing tasks, one is not, and that's the distinction. So yeah, again, the distinction between trained and not trained. Next slide. Okay, so let's compare. Anne, do you want to read these scenarios for us?
Yeah, yes, sure. Okay, so under service dog, Marge has a psychiatric disability. Her dog Bumper can tell her when her anxiety level rises. Bumper has been trained to respond by moving himself in front of Marge and nudging her away from her current location. So kind of nudging her to go in another direction. So under pet dog, Aaron has a psychiatric disability. His dog Floppy is a good-natured and can tell when Aaron is becoming anxious. However, Floppy is not trained to do anything to help Aaron.
So you can see there in those examples that Anne just read, the first dog, it's actually performing a task. It's alerting its human, it's nudging its human, it's getting them into a safe place. Whereas Floppy, although I'm sure amazing as someone who loves dogs, is just helping its person by being there. So it's performing a task versus not performing a specific.
Hey, Claire, can I jump in here for a second? Gabe, can we go back to the previous slide 19 for a second? I just wanted to underscore, because the other things is that the other laws like state laws and Air Carriers Access Act, et cetera, have different requirements for service animals and assistance animals, et cetera. And honestly, when it comes to animals, that can become very confusing. Today, we are only addressing the requirements of the Americans with Disabilities Act, but your Regional ADA Center can answer questions specifically if you have questions about air carriers access, fair housing, local and state laws as well compared to the ADA. I just wanted to kind of highlight that to let people know that. In addition, I'm not sure, did you talk about therapy animals?
Yes, I think we mentioned those
Okay.
briefly. We can go over them again. Therapy animals are often dogs and can be other animals, but often dogs that can go to hospitals. But again, they're there to make you feel better just by virtue of being there. They're often certified through local programs and things like that. But again, they're not performing a task. They're just there to make us feel better. And they do a
Right.
really good job.
Right. And they're not trained,
Mhm.
they're trained in general, but not for a specific person
Task.
like a service animal is,
Yeah.
which is a good differentiation. So it can get very confusing because I think today in our lexicon, people use service animals and emotional support animals interchangeably. At least I've heard that before and
Yes.
had to straighten people out about that. So,
In fact, I'm just like Anne. I often jump on people when they use the wrong term and interchangeably, and not to be rude, but when people will say, "Oh, well, my friend has an emotional support animal," I'll say, "But is it an emotional support animal or is it a psychiatric service animal?" Just to see that, make a point that there are differences. They're both wonderful, but like Anne was saying, under different laws, they have different rights. And like we're saying today, under the ADA and healthcare facilities in Title II and Title III, only service dogs are per.
yeah. And if we go to slide number 20 again, the nuance here, I think, is important to highlight. And Claire, I think you did highlight that. Both people have a psychiatric disability. Both people have dogs. I'm sure Floppy provides Aaron with a lot of comfort, and
Mhm.
he's his pet dog. And as Claire has highlighted and underscored a lot, he has not been trained to do anything specifically for Aaron. So there is a difference between Floppy and Bumper, even though they are both dogs for, and their owners are people with psychiatric disabilities. Okay,
Exactly.
we're back on track, Claire. Slide 21, please. I think that is.
Yep, I think that's right. Perfect.
Okay,
Thank you.
good.
So dogs are miniature horses. What's the difference? Besides the obvious. No, I shouldn't say that. So service dogs must be allowed in virtually all areas where members of the public are allowed to go. With the exception of a few very specific examples or situations where service dogs might be allowed that I think we'll go over in a minute. Service dogs are allowed virtually everywhere the public can go. The difference there, is there's a few more qualifications for miniature horses. In that situation where you might be a public place of business, a nonprofit, etc., there's a few different qualifications that the facilitators of the location are allowed to consider when you're talking about a miniature horse service animal versus a dog. So the additional considerations, next slide. So you can consider the type, size, and weight of the miniature horse and whether the facility can accommodate these features. So I've personally never interacted with a miniature horse, but I'm assuming they can be a little bit bigger, right? My guide dog, she weighs about 55 pounds. A miniature horse, probably going to be quite a bit bigger than that. And in a lot of circumstances, that's probably not going to be a problem, but there could definitely be some situations where that could be a problem. And so that's why with miniature horses, unlike dogs, they're allowed to consider a little bit more. And you can think about the legitimate safety requirements that are necessary for the safe overall situation of that location. So again, you can't just say, "Oh, it's a miniature horse. I don't want the horse in here." They still have quite a few of the same rights as a service dog. The person who oversees that location, though, just has the right to kind of ponder a little bit deeper about the different safety and situational considerations of that location.
Claire, we have a couple of questions, so I want to pause here for a second if you're
Perfect.
willing to take a couple of questions.
Yep.
Okay. So Claudia asks, is it safe to say a service animal is trained to do a physical task versus just a task?
That's a really great way of putting it. I'm always nervous to say physical because physical could have some implications that people might think, it doesn't apply to psychiatric service animals. But I think you are kind of nailing it on the head, though, because even the tasks that a dog performs for somebody with a psychiatric disability do tend to be physical. Again, nudging them if they're having an episode, pushing them into a corner so they're safe and they're out of harm's way. So I think that is a pretty good way of defining it. Again, I would just be a little bit hesitant to use it too strongly, just because if you say physical, it does, at least in my opinion, come off a little bit specific. But in general, I do think that's a good way of thinking of it.
Yeah, that's a good nuance. Another question, and I'm sorry, Deep T, I think I'm mispronouncing your name, but good question. Are service animals always trained in conjunction with a specific guardian?
Oh, so I'm going to clarify the question from what I'm hearing, and tell me if you're hearing different and chime into the person. Are you asking, is the service animal specifically trained for that one unique person? So for instance, was my dog trained for me specifically?
Right, exactly.
Okay.
That's how I interpret it.
Okay. So that's a great question. Based on the definition, it kind of sounds that way, right? But not necessarily from the get-go. For instance, I have received all of my dogs from a school called Guide Dogs for the Blind that's located in California and Oregon. When they start training the dogs, they start training them literally at like 10 weeks old sometimes. At 10 weeks old, they don't know they're going to go to me because they have to do all kinds of training and things like that. So technically in that respect, no, they're not going to know they're going to place the dog with me until it's pretty much done going through training. And then they say, hey, we think that Tulane is a good match for Claire. So in that respect, no, they don't have to necessarily know exactly who they're training the dog for before it's placed with the person.
Now, so when you were paired with Tulane, did they then go further and like train Tulane in anything specific for you, or did you do that once once you two adapted to each other?
Yeah, it's kind of, I almost consider it like a relationship, right? Like we have to
Yeah.
get to know each other. We have to get to know each other's like ways and motions and things like that. So yeah, as you start to work with each other, you get to know how each other work and understand each other. So I would never hand the leash of my guide dog over to another blind friend and say, here you go, because no,
Okay.
we work
Yeah.
together. Yeah.
Because Tulane gets to know you just as well as you get to know Tulane. And so, yeah, that makes sense. So they're trained in general as puppies until then they're paired with the individual who they're going to be with. And then they get to know each other and develop that relationship. Okay.
Yeah. My
And
friend, one fun example is a friend of mine who I talked about who has the dog who pulls her wheelchair. The muscular disorder has impacted her vocal cords, so she can't speak very well. So she's taught her dog all of his or her commands in American Sign Language. And so her
Wow.
dog wasn't initially trained to do that, but now to accommodate herself, that's how her and her dog communicate. So it's kind of become a personalized thing.
That's great.
And this is Pam. Another thing that that the ADA addresses is the fact that a dog actually can be trained, does not have to be trained by an organization or certified. So a dog could actually be trained by its handler or person. Just as you were talking about how your friend trained her dog with the sign language.
Mm-hmm. Exactly. I think that might actually be on a slide in a minute. I'm not sure, but that's a great distinction to make.
Yeah, and there was a question about that in the chat too. All right, I think we can move on to slide 23.
So slide 23, questions and expectations. So next slide. What can you ask? Oh, this is my favorite thing. I explain these questions to people all the time because unfortunately, those of us with service dogs get asked all kinds of questions all the time. So I like to tell people what's technically the legal questions under the Americans with Disabilities Act you are allowed to ask and when you're allowed to ask them. So there are two questions that can be asked about dogs or miniature horses. when the disability is not obvious. So I don't know, you could ask Anne. I think it's pretty obvious that I'm blind. I'm reading Braille, etc. So if I'm in public and it's pretty obvious that I'm blind, you're not permissible. It's not permissible for you to come up and ask me these two questions because it's obvious. You know, if a person is using a wheelchair and has a dog assisting them, in my opinion, that's pretty obvious why they have a service dog. So in those situations, it's inappropriate or not even permissible to ask these questions. But let's say somebody has an invisible or hidden disability and it's not quite as obvious, and you own a store or restaurant, or you're in the healthcare setting, and you want to make sure that that person has a service animal for a legitimate reason, you're allowed to ask two questions. Is this an animal needed because of a disability? So is there a linkage between having the dog or the horse and having a disability? You're allowed to ask that. And then this second question, tying into what we've been pounding home a lot today already, what work or tasks has the animal been trained to do? So one, is the dog or horse, do you have that animal because you're a person with a disability? And two, what task has it been trained to perform? And so if the person can't answer properly to those two questions, you're allowed, excuse me, to say, I'm sorry, can you please remove the animal from the healthcare setting? If the person can answer those questions, then it's permissible for them to remain with their dog or horse. Next slide. Should you ask the questions? So we were just kind of talking about this. Remember, you should ask the questions if it's, you shouldn't ask if it's obvious that the animal is working for a person with a disability. Somebody's using a wheelchair and they have a dog and you see the dog pick something off the floor. Seems pretty straightforward to me that that dog is performing a task for somebody with a disability.
Claire, I'll just chime in and say,
Yeah.
I think the point of this, so if there's an obvious disability, you know, you don't ask the question of if it's here to perform tasks. However, and so this is something that you want to train staff, especially receptionists and frontline people about, not a policy of, okay, if there's a person with a service animal, ask these two questions. Is it, and always ask these two questions? No, they want to use their common sense. And if it's an obvious disability, they don't need to ask.
Exactly. Next slide. Things you may not ask. You cannot ask for documentation, certificates, proof, or details about someone's disability. So let's talk about the first part. You can't ask for documentation or certificates. Couple of reasons there. First of all, you can't ask for documentation of someone's disability because that's inappropriate and not permissible. You can't say, Claire, give me a document from your ophthalmologist that says you're blind. Not permissible, not appropriate. You can't ask for a certificate because there's no such thing. I'm sure there'll be questions about this in talks because this is a widely wrongly assumed thing. There are no certificates, not from the Department of Justice, not on a state level that I've ever heard of. Under the Americans with Disabilities Act, you don't have to have any type of proof that your dog is indeed a service dog, because just like was just said a moment ago by our other presenter, you can self-train your dog. So because of that, it might not even come from any known school. It's totally permissible to train your own animal. So because of that, there is no certificate. So don't ask for it because we're gonna give you a funny look because it doesn't even exist.
Well, and it's interesting, Claire, there is a cottage industry that has sprouted up since the ADA passed, and I'm sure before then, of certifications for dogs that promise people they can get their dog certified. And one of these even had DOJ on the certification as well. But these are not valid certifications at all, and because there is no such thing as a service animal certification.
In fact, I often tell people that usually the surefire way to know that it's not a legitimate service dog is if they say they have paperwork. Now, there are other situations that we won't go into because it doesn't have to do with healthcare under Title II and Title III, but under laws like the Fair Housing Act, documentation is permissible for emotional support animals. So sometimes people get confused, but just know they're very different laws and they have to do with very different things. So again, you can't ask somebody details about their disability, about the animal's training. Another thing to note, many service animals wear harnesses, vests, or other items, and that's how you can identify them. However, legally, they're not required to do so. So some people might have a dog that's just purely on a leash, and that's permissible under the Americans with Disabilities Act. So don't assume because the dog is not wearing something that it's not a service animal. Now, I'm going to tell you from personal experience, and I've been involved in the disability community for a long time. I've personally never met a dog or horse that doesn't have some kind of harness or vest, but just know what the law says, because I guarantee I'll say that today and then somebody will call me tomorrow and be like, I met somebody with a dog that had no official harness for whatever reason. So just know that's the distinction in the law.
Yeah, and I've been around for a little while. I've never met anybody who had a freestanding service animal without a leash or a harness. So Claire, we have a question. Can any type of dog breed be a service animal?
Ooh, that is a great question. Yes, absolutely. Any breed of dog. So from the tiniest little Yorkie up to the biggest, Saint Bernard, breed and size is not specific. Now I can tell you feasibly from what I've seen in life with peers who have disabilities, there's often a direct correlation. You have a balancing disability like we talked about, you're probably going to have a bigger dog because a Yorkie is just not going to help you. If you have a psychiatric disability and you need a dog that'll help you, a smaller dog is probably able to do that. The size isn't as pertinent. So different situations, yield different types of dogs. But no, at the end of the day, there is no breed specification. I'd say what you often tend to see are Labradors, German Shepherds, Golden Retrievers, but I never want to say if you see another breed, that's not a service dog because it can be anything. So.
Right. And yes, you say that and then you'll hear a million stories about the breeds that you aren't aware of. Okay,
Yeah.
Taylor has a good question, Claire. So about what we were talking about before, obvious disability. What is the threshold for what constitutes a quote obvious unquote disability or task?
That is a wonderful question.
That's
And
what I thought.
the lawyer in me gonna say it depends. That it's a kind of a moving target. Oh, I mean, this is not legal advice. This is my own personal, this is Claire perspective as a person with a disability. I think it's okay to ask if there's even an inkling of questioning, as long as you ask the questions appropriately and by the book. Just because at least then you're gaining the information. Again, that's no legal advice. That's not coming from the ADA National Network. That's my opinion, because if there's any inkling of confusion, you might as well just ask and get the questions out properly. But it's a moving target. It's hard. Again, in my opinion, there are some things that are pretty obvious. Somebody looks blind and they have a dog. If you use a wheelchair and you have a dog, but there are a lot of things that aren't obvious. So I personally am not offended. Even as someone who's blind, I've been asked those questions before.
I was going to say, have you been asked those, Claire?
I have been asked those before. And you know what? I usually, with a smile, I answer those questions because I know they have read their ADA policy and they know what questions to ask. So I actually kind of smile and nod my head because I'm like, you know what you're legally allowed to ask. And I answer them politely. So.
And another good question from my friend Lori, can someone ask your dog to demonstrate how they are helping?
Great question. Absolutely not. Nope. Demonstration is not a permissible thing to ask. One, it's just not appropriate. But two, think about it. For some types of service dogs, they can't demonstrate in the moment. If you have a seizure alert dog, hopefully you're not having a seizure. So you can't say perform the task because the dog's going to say it's not time to perform the task. But no, legally it is not permissible. And practically it's also just not doable in a lot of situations.
Okay, another good question. And, I find whenever I talk about service animals or we get what if. So we're getting a few what ifs. And Michelle says, what about a person in a wheelchair with a small lap dog?
Mm-hmm. No, that's a great question. And I think that's where asking a question, in my opinion, would be appropriate, because you might not know, because you're bringing up a good point. Sometimes the person may still have a disability, but the type of, the circumstances might not look like what you think the dog would perform. So maybe the person's a wheelchair user, but they don't have a service dog that pulls their wheelchair. Maybe they have a psychiatric service dog because they also have PTSD, and it's a smaller dog, and that dog helps them when they're having an episode. And so I think that would be an appropriate time to ask those two questions, because it's true. You can have one disability that's more obvious, and then you could have another disability that's not obvious, and the dog could be for that disability. I personally have a seizure disorder. I don't have a seizure alert dog, but if I did, people would probably think, oh, she's blind, she has a guide dog. But I could have a seizure alert dog, and that's not obvious. So
yeah, it gets complicated. Okay, let's get back here. We still have lots of questions, but we can get back to the presentation, and then we'll get back to some more questions.
Cool. Okay, so what to expect? The service dog or miniature horse must be housebroken, be under control at all times, have a harness or leash, except for the caveat that if the individual can't hold on to the leash for any reason, or being off the leash is related to the task it's going to perform, then it's not required. Yeah, so let me go back to those. I just kind of rattled those off. But again, it has to be housebroken and be under the control of the person. You could have I am blind. I have a guide dog that came from a guide dog school. For all intents and purposes, she is in fact a guide dog. But if she's rolling around in mud and jumping up a storm and lunging and barking, which my dog would never do because she's an angel. But if she did all the businesses still have the right to say, ma'am, you need to take your dog outside. If I took her into a hospital and she was doing all those things, that hospital has every right to say, ma'am, you need to remove your dog from the premises. So just because a dog is a legitimate service dog or a miniature horse, they still have to be under control. They still have to be clean. They still have to be wearing a leash, except for with that caveat, all of the above. Again, they have to be tethered, with the exception that there are times that the task that the animal performs related to the type of disability that the person has might make a circumstance where having a leash isn't possible or would impede the tasks that the animal is performing. I have personally never seen that. I understand what the definition is implying. I've personally never seen it, but just know that it does exist. Next slide. So excluding a service animal, you can ask a person to remove their service animal or miniature horse if, and kind of going back to what we were just talking about, they're not housebroken, the animal is not under the control of the person. I have met people who say, oh, my dog is a service dog, and then that dog starts lunging and growling and, pouncing at my dog. That dog isn't under your control. I don't buy it, but that's the whole other thing. Even if it is a legitimate service dog, it still has to be under the control of the person. So if the animal is jumping around, barking, growling, snapping, and the person can't control their own service dog. So again, you have to be able to control your dog or horse. Next slide. So allergies and fear of dogs. I see these questions and these circumstances come all the time. So what if the employer, other people at that hospital are afraid of dogs or have allergies to the dog? These are not excuses to exclude the person with the legitimate service animal. You have to make other accommodations, but you can't say that that person cannot remain in the healthcare setting because someone's allergic or afraid of the dog. If someone's allergic, then get creative. If your waiting room isn't big enough to keep the two people far enough away from each other, maybe go find an empty room that the person with the allergy can sit in, or vice versa. Just separate them. If someone's afraid, maybe call in a new person, but you can't use that as an excuse. I was telling Anne when we were talking, when I was in law school, I went to the health center one day, and the doctor walked in. She stopped. She backed up, closed the door, and walked away. And I went, "What just happened?" Turned out she was terrified of my dog. And so she had to send in a different doctor. But that was no excuse for them to say, "We can't provide health care to you," just because the doctor was afraid of my dog. Thankfully, there was an alternative healthcare provider that I could see. But if they didn't have an alternative, that doctor would have to dealt with that fear, because that was my right to get healthcare treatment.
Yeah, and I think that what you're underlining here, Claire, is the necessity to get creative and to problem solve here,
Mhm.
and really think about how we can meet both needs.
Exactly. Yeah.
So great.
Yep. Exactly. Next slide. Just talking about the fact that when you do have a circumstance where the dog can no longer stay because of its cleanliness or behavior, you can't tell the person that they can't be there. It's removing the dog. So just a clarification. We would never say you can't come in. You would say, "I'm sorry, ma'am or sir, you need to remove your dog or horse from the premises," and then you're allowed to return. So just putting an emphasis on what the law says. It's not you can never come back. It's just that you need to remove your dog from the premises. Next slide. Care and supervision. This kind of ties in, I think, to what we were just talking about, but individuals with disabilities are responsible for the care and supervision of their dog. Again, I need to keep my dog clean. I need her to be under my control. In a healthcare setting, the staff is never responsible for the care of my dog. I have to water it, take it out, all those kinds of things. So I can never turn to a nurse and say, "I'm not feeling well, take my dog out." I had an incident several years ago where I was feeling really poorly, so much so that I had to take an ambulance to the hospital. And I think when I was in the ambulance, I called one of my best friends and I said, "I don't know what's going to happen. I'm here." And of course I called her because I wanted her to be there for me. But I also called her because I went, "What happens if they need to take me back for a test, or my dog needs to go to the bathroom?" So I called her because I was thinking of my dog and making sure that there was someone to take care of him if I couldn't do so in that situation.
So Claire, let me clarify. So the handler is responsible for the care and supervision of their dog.
Exactly.
Okay. Now, in a healthcare facility, Diane asked this, in a healthcare facility, if the patient is not able to provide care for their dog due to their medical condition and they have no families or friend to care for it, what are the alternatives?
Oh, that is such a tough situation to be in.
Yeah.
Legally, at the end of the day, the healthcare facility just doesn't have to take care of the dog. Hopefully, maybe you could bring a social worker in, you could call a family member, a friend, you could get creative, maybe reach out to I'd hate to say a shelter, but hopefully a social worker could help you get creative to find an alternative. But legally, at the end of the day, the hospital or healthcare setting does not have the obligation to take care of the animal. Now, if they want to, they can always go above and beyond, and that's so kind. But at the end of the day, that is what the law says.
Well, and then Lilia, I think that's how you say your name. If the staff volunteer to take the dog out or feed them, is that okay, or are there legal issues there?
I don't think there really, we live in a litigious world where hopefully no one would ever want to go after you for liability if something happened to the dog, which is a whole other can of worms. But under the American with Disabilities Act. No, there's nothing wrong with that if you ask permission from the handler of the animal.
Yeah, and you also think about what is that situation where the person with the disability is, you know, either unconscious or unable to care,
Mhm.
you know, to supervise the animal at all. So the animal is there. And so hopefully they have information about an individual who can come or get connected to. And in the meantime, the animal is there. So hopefully somebody would, you know, take care of it. And,
Yeah.
but again, there's not the obligation under the law.
Exactly.
Yeah, and somebody wrote in, staff should adhere to their company's policy regarding service animals if they have one. So, and that would underscore our suggestion that everyone have a service animal policy.
Exactly.
Okay, moving right
Um,
along.
Slide 32, just a quick mention about relief areas. You're not required to have one. However, like Anne was just talking with policy, this is another thing that would just be a good best practices if you have a service relief animal area. So many of us have service animals now that even just for cleanliness reasons, just be really helpful. And so then if we are in a setting where we need to take our dog out or our miniature horse, if there's a relief area available, it just makes it easier. And I think just better for all parties involved, but it's not legally required. Next slide.
Yeah, and the other thing is, if you have a designated relief area, I think it really shows something about the healthcare facility or the hospital, and that
Absolutely.
you're anticipating and you're proactively accommodating people with disabilities, which is always a good thing.
Absolutely. So slide 33, what about state or local laws? Just know that the Americans with Disabilities Act is a federal law, so it acts, oh, sorry. So because it's the federal law, it kind of acts as the floor, so to speak. It's what's legally required at the federal level. But if states or local governments want to go above and beyond, they always have that's right. That's how it works in the United States. So you can always do some research to find out what you might have at the state or local level. I'm embarrassed to say I don't even know what my Maryland policy is where I live. I just know the federal law, but just know that you can do some research to find out if your state or local government provides additional rights to persons with service animals.
And my understanding, Claire, is with state or local laws, whichever provides the most protection for people with disabilities takes precedence.
Precedence, exactly. Yep, exactly.
So you definitely want to check state and local laws when it comes to anything related to animals. I think that's important.
Absolutely. Next slide. Surcharges. Extra fees may not be imposed on people with service dogs or service animals. Even if your facility accepts pets and generally has a charge for pets, you can't put that charge on to a service animal. Service animals are not pets, so there's a distinction. You may charge the person with the service animal if the animal actually causes damage. So it kind of goes back to that concept. We're still responsible for our service animals. So if the service animal causes some kind of damage, chews things up, scratches things up, then you are allowed to charge them for damages, just not a surcharge for being there in general.
Okay, so when you go to a hotel, you don't get charged a pet fee?
Absolutely not. Nope.
Okay.
Yep. Now, I can't tell you how many times when I go on Uber and Lyft, they try to charge me a fee for my dog's fur, but I always contest those because that's not permissible.
Well, that's good to know. That's good to know.
Okay, so next slide, service animals and healthcare facilities, making decisions. So you have to evaluate the service animal, the patient, and the healthcare situation on a case-by-case basis. This is a lot of things under the ADA where case-by-case basis is really important to look at. So to determine the significant risks of harm that exist, So again, you want to look at, the ICU. Maybe somebody is extremely sick and the presence of a dog would be detrimental. You really need to think about those kinds of circumstances. Whereas if you're just in the waiting room in the emergency room, probably doesn't have the same issues. Determine whether reasonable modifications to those policies, practices, or procedures could mitigate the risk. So that's kind of going back into the allergy situation, that modification to the policy would be maybe putting somebody in a different room instead of the waiting room. So again, like Anne was saying earlier, being creative about how you accommodate those people, not just making a blanket statement that, oh, the other person's allergic to dogs, you have to remove yourself from the situation.
And Claire, we've included a link to the guidelines for environmental infection control in healthcare facilities, which are recommendations from the Centers for Disease Control in the Healthcare Infection Control Practices Advisory Committee, which reviews previous guidelines and strategies for preventing environment-associated infections in healthcare facilities and offer recommendations, evidence-based recommendations supported by research and studies, requirements of federal agencies like FDA and the EPA, Department of Labor, et cetera. And guidelines and standards from building and equipment professional organizations. One thing I have learned from my years doing ADA work is go to good data sources like this to get your information for your policies. You really want to operate on facts, not assumptions, oh, if we allow a dog, it's going to be fill in the blank. You want to operate on facts and create your policies accordingly. Okay, that's my soapbox on that.
Next slide. This is kind of stuff we've already been talking about, but good things to ponder. So if a patient must be separated from their service animal, again, in a healthcare setting, I'm sure that's primed to come up for a lot of reasons. The person should determine arrangements that they can make. Again, as somebody with a service dog, I even try to make those ahead of time. And find supervision and care for the animal during the period of separation. And make appropriate arrangements to address the patient's needs in the absence of the service animal. So I use the service animal to get around safely because I'm blind. So if I can't bring my dog with me, someone else needs to guide me. So just know that in the absence of the animal, you do have to provide that accommodation that the dog performs for the person with the disability, since the dog isn't there. Next slide. I believe we have an example of some policies and procedures that a hospital might have. Is that on the next slide, Anna, or is that just a title?
Next slide. Yeah,
next
this is just a title. Okay. Yeah, okay, yeah.
Okay. Again, so kind of like Anne was referring to earlier, you don't have to have a policy, but it's really helpful. It's like anything in life, right? If you have something on paper, it's going to help set the stage and give people's specific directions.
And Claire, just to underscore that, we've seen in a lot of situations that how important having policies and doing the staff training is, especially in healthcare facilities. It's not the bosses and the policy people who get the hospital in trouble. It's the frontline staff who weren't aware of the policy or had never been to the training before, as we've experienced ourselves. So.
And I apologize, I had to put myself off of video for a second because my phone is dying. So I'm still here, I promise.
Okay, all right, great.
So next slide. It looks like we have some examples of some policies from Michigan.
Yes, there are links to service animal policies for hospitals and facilities, service animal arrival checklist, service animal exclusion assessment. Paperwork and paper trails are always a helpful thing to have. Right, Claire?
Absolutely, says the lawyer. Yep.
All right, slide 40.
Okay.
And now I think we have some settlement agreement resources, links to settlement agreements with the Department of Justice. Here's one under Title III, the settlement agreement under ADA between the United States of America and Dr. Bruce Berenson. And there's a link there in the slides, and there's an attachment A there, which is a policy regarding service animals for customers with disabilities. So there are quite a few resources here. And Claire, I'll go ahead and go through the next few.
Awesome. Okay.
Slide 41. Stanford Healthcare. This is in California under Title ADA Title III. Here's a policy summary, service animals in Stanford Healthcare facilities. And then Stanford Hospital and Clinics policy on service animals and comfort and emotional support dogs. And the next one, slide 42, is Johns Hopkins Medicine in Maryland under Title ADA Title III. Arriving with a service animal handler responsibilities. And if I've tried to pronounce this in Spanish, it would be an embarrassment for me and very insulting. So I am not going to, but they have it in Spanish as well. Slide 43. Okay, so now Pam Williamson, Pam, if you want to turn on your camera, is going to take us through some resources before we get to an opportunity to ask questions. And we've got about 15 minutes remaining. So Pam, can I turn it over to you?
Certainly. Thank you, Anne. All right, so next slide, please. And so just to let you know, this PowerPoint and the information will be available in an archive. So and it was also sent ahead of time. So make sure you check your email and check your spam folders. So we have again the link to the ADA Title II regulations on reasonable modifications. And so that is on the ada.gov website. Next slide, please. Then we also have the ADA Title III regulations for public accommodations and the definition of reasonable modification. So next slide, please. I want to make you aware of some resources from the ADA National Network. There is the Service Animal Resource Hub, and so there is a wealth of information at that hub, and we encourage you to check it out if you have any questions about service animals or some things that you may not have been able to get answered today due to the wealth of information that we've shared with you. And then we also have a fact sheet on healthcare and the ADA. Next slide, please. The U.S. Department of Justice also has information on service animals. They have a service animals page where they provide a list of information about service animals. They also have a couple of fact sheets, one on ADA requirements for service animals, and then frequently asked questions about service animals in the ADA. Next slide, please. So we referenced these earlier, the resources from the Centers for Disease Control and Prevention, the guidelines for environmental infection control and healthcare facilities, and then service animals and dental healthcare settings. Both of these documents provide excellent information about how to address a service animal in a facility where there may need to be infection control and things of that nature. So I highly recommend these resources. Next slide, please. And then the U.S. Department of Health and Human Services has a fact sheet on understanding how to accommodate service animals in healthcare facilities. Next slide, please. And at this point in time, we do have time for a few more questions. And I wanted to reference one question because I think this is important. So it says, when infection control measures are required for things such as MRSA or MRSA or COVID that require those meaning healthcare providers or visitors entering the room to wear protective gear such as gloves and a gown, can they deny my service dog access? And what if my service dog has shoes, their own disposable gown and coat, and eyewear? So Claire, what do you think?
Oh, that is a tough one. I'm just trying to process the different variables that are going on there. I don't, Pam, I think I might toss this one to you, to be honest.
Okay. Well, I think in this case we have to look at several things, but the first thing is, if you have determined, this is a service animal and the person can be responsible for the service dog while they're there, then you've also got to look at the direct threat issue when you're looking at MRSA and COVID, because those can be transferred. COVID, we know, can be transferred via animals.
Right.
MRSA is very, very infectious. And so, it would really, this is another time when it would literally need to be looked at on a case-by-case basis, and a direct a threat assessment be done before making any decisions about whether or not to remove the service animal.
Yeah, that's a tough one. A couple of others that I have seen, ambulances. Do ambulances, must they allow service animals?
I'm smiling because I was in this very scenario myself. A few years ago, that same incident I had talked about when I went to the emergency room, the urgent care I went to called an ambulance. And the short answer is yes, service animals are very, very much so still permissible to go on an ambulance. Now, again, the dog has to be under your control at all times. So heaven forbid you're unconscious, obviously that makes things different, but I was still completely with it. I walked onto the ambulance myself, and so yeah, they had to let me go with my dog, and it was extremely frustrating because usually I'm a great advocate for myself and I can explain what the ADA says, but I was feeling absolutely horrible. And so they were the paramedics were looking at each other like, oh, do we have to let her on? And I was going, yes. And usually I'd quote the ADA, but I was not feeling so well that day. So, but yes, the short answer is yes, with the exception that, again, the dog has to be under your control. So obviously if you're unconscious, heaven forbid, that's gonna bring up other variables.
Well, and a couple of people have typed in that in their areas that they the dogs can stay. Here's Shiloh says, I'm an ACO officer and I get called by the hospital in town to transport service animals the individual cannot care for due to length of stay or their condition. And they put the animal under protective custody in the shelter for 5 days, just temporarily. So I think they're different things. Now, Liz writes, and I really appreciate this comment, Liz, I am a Red Cross Disability Integration Pacific Division and have service dogs in our shelters. We use multiple solutions for issues with people who are allergic or frightened of a dog. We use common sense and flexibility and sense of humor to handle service dogs. So, I love that point about common sense and flexibility and sense of humor. I think that sometimes gets lost in these conversations. Something we haven't talked about, Claire, can other clients pet service animals?
Oh, that is a great question. So, those of us who have service dogs always ask that you ask us first, but it's really important that our dogs or miniature horses are under our control at all times and that they're focused on us because we want to make sure that they're doing their jobs so that we remain safe for whatever reason that we have that dog. So if you pet our dog, if you're talking to our dog, if you're whistling at our dog, it's going to distract them and then they can't do their job. So the blanket rule is no, please don't pet, please don't talk to them. However, if I'm in a situation, say I'm at a Starbucks and I'm hanging out, my dog's not really working because, we're just sitting there. If you ask, I might say yes. So always ask, but in general, especially when our dog is working, please do not pet or talk to our dog.
Yeah, and always asking is, I think,
Yeah.
is really important. Yeah, and Jerry, I appreciate what you wrote too, about the importance of having an emergency plan for the service animal. So, like Claire, like you were talking about the need for service animals handlers to have an emergency plan in case anything happens to it, and make sure people know about it, so people can be notified in advance, I think, is the key here. All right, what other questions do we have? Here's one. Can a service animal be permanently banned from a facility? At a prior job, I worked in public transportation where a rider's service animal was not under handler's control on a regular basis, with documentation showing as such. One time the animal attacked another animal, and I assume they banned that animal.
Sorry, I wasn't sure if I heard the question component of it or if it was more of an example.
Can a
but that's
service animal be permanently banned from a facility?
Oh, permanently banned.
Yes.
Oh, that's a good question. I don't know if there's a permanent policy under the ADA. There again, there's the part where you can always say you need to remove your dog from the premises. But I don't know if you could technically permanently ban them. It's a good question.
Yeah, and I'm wondering if this really is a service animal.
Yeah.
If there were numerous occasions where this animal wasn't under the handler's control on a regular basis, and the company had documented that.
Yeah.
So,
Anna and Claire, we've had a few questions asking about service dogs in training and if they're covered under the ADA. So Claire, would you like to address that?
Yeah, that's a great question. That goes to what we were talking about, state and local laws. So under the Americans with Disabilities Act, no, service dogs in training don't have the same rights. But wonderfully, in my opinion, many states have adopted policies that say they should be treated the same, which really helps with their training, right? If they have the same access, then they're going to get the training they need. So for instance, I'm originally from California, the great state of California, and they have a law there that says that service animals in training have all the same access rights as working service animals. And to my knowledge, I think that's becoming more and more commonplace, but I can't say if it's in all 50 states. So do your homework to find out where you live, but it is becoming more commonplace because it's very helpful for training purposes.
yeah, and okay. Rich has asked, must a person with a hidden disability prove that they require a service dog? And I know we kind of answered that, but it's a different way to phrase it.
Yeah. No, when I hear the word prove, I hear that they want you to somehow show that you have a disability. Absolutely not. Just reviewing the two questions, they can ask the person, do you have a disability that, do you have this dog as a reason why you have the dog is your disability? Can't get that out. And then two, what task does it perform? So they can't say, oh, you have X disability, prove it. All the person would have to say is, yes, I have this dog because I have a disability, and the tasks that it performs are X, Y, and Z. They would never have to prove that they have that disability. I mean, I guess theoretically you could argue that by saying the tasks it performs, it kind of indicates that. But to me, there's a difference between that and physically proving in some way you have a disability.
Well, and they don't necessarily have to say what their disability is.
Absolutely.
Well.
In fact, they're not legally required to. Yeah. Sometimes it comes out in the wash when you're saying the task is performed, but no, that is one of the specifications. You do not have to say what your disability is.
Yeah, I guess, Claire, one of the questions I would ask you is, when we do a lot of training, I don't know if this has been your experience, Pam, and, I talk to guards at libraries and frontline people in healthcare facilities, and they want to they really want to honor people with disabilities who have service animals and, allow them. But there have been a lot of people who've tried to pass their animals off as service animals and might be savvy and know the answers to these questions. So I guess, how would you recommend the audience, how do you deal with that when you see that happening?
Oh, that is $1 million question. I personally just encourage people to continue to know the two questions. And it's true, people might know how to beat the system by answering the two questions, but at the end of the day, if they can answer those two questions, you can't go any further. And, it's one of those things where, for every 9 people who gain the system because they know how to answer the questions right, there's probably a person in there though that truly does have a disability. And so I'm glad that that person was able to gain access. So I know that's not some magical helpful answer, but it's just kind of the reality that is. Pam, I don't know if you have a better, more helpful answer, but that's just kind of the reality that I've learned to sit with. So
Yeah, I think what you said is right on target. So
Yeah, and I think the purpose of the ADA is civil rights and inclusion here, and we're trying to include.
Mhm.
So if we err on the side of inclusion,
Yeah.
is that, but and again, it's a tough one when it's hard because our society loves animals and their pets, and they're therapy dogs and emotional support animals and service animals. So it, a little information is a dangerous thing sometimes, I think. And so, which is why we really want to provide good information about what the Americans with Disabilities Act requires, and encourage you to contact your local centers to answer specific questions, especially what's the difference between a policy on the Air Carriers Access Act and the Americans with Disabilities Act, or Fair Housing Act and the ADA, or state and local laws, because it is complicated and not as straightforward as maybe we would like it to be. So we are here, and we've been funded since 1991 to answer questions about the Americans with Disabilities Act, because so many situations related to the ADA are a case-by-case basis, and that we're here to help you. 1-800-949-4232, adata.org. Claire Stanley, thank you so much for
Of course.
coming today and presenting. We really appreciate your sharing your personal experiences, your expertise, and thank you. Thank you.
Yeah. Thank you for allowing me to be here. Thank you.
Yeah, it's great. Pam, did you want to say anything before we sign off?
I just thank everyone for being with us today, and Claire and Anne for your leadership on this very important topic. And just remind folks, if you do have questions, please contact your regional center, as Anne was saying, at 1-800-949-4232. And the presentation will be available in archive, and you'll be getting an email about that.
Great. Well, thank you, everybody. And wherever you are in the country, we hope you have a good rest of your day. Here we go, 4 o'clock Eastern.
I hate to jump off,